Appreciate everyone coming out this evening. I want to thank our administrative staff, our nursing staff, and our clinical staff for orchestrating this beautiful night. We're in a beautiful room with the view of the city and a lot of beautiful folks. So what I'd like to discuss tonight is basically the crux of my research, ways that we can identify to improve patient outcomes, the patient experience, and basically how to take better care of patients. For those of you who may not know, I've been at Penn since the year 2010, and my practice focuses on two aspects. One is taking care of patients who have skin cancer and reconstructing so that we can achieve the best cosmetic results. And then the second part is taking care of patients who have cosmetic concerns and assisting with procedures that are laser-based and other aesthetic procedures. Now, the combination of these two aspects of my practice, I think, offer me a unique experience and give me the ability to try and share with you what I've experienced over the past 7 or 8 years or so. Now, what I'd like to do is have an exercise here. I'd like you to take a look at the photos on the left and the right and form an opinion. Please see if you can identify where you may see a difference. What I'll share with you is that this is a patient who had a skin cancer, and the photo on the left is before her skin cancer was taken out, and the photo on the right is after it was repaired. Now that you have that information, you have additional information to formulate either the same opinion or a different opinion. Now, I have an opinion because I assisted in the repair of the patient. The patient has an opinion of this outcome, and you, as an onlooker, have your own opinion. Which opinion matters the most? I would argue that that is 100% correct. The patient's opinion matters, but the patient's opinion is influenced by everyone else's opinion. And so there are multiple stakeholders at play in the care of patients who have skin cancer and the care of patients who are seeking cosmetic treatments. I'm fortunate to be at one of the world-renowned institutions that gives me the ability to care for patients both with clinical practice, a research practice, and an educational practice where we can train fellows and residents. And being at this institution gives us the ability to study these questions that we ask, because obviously the patient opinion matters significantly, but I think that societal view and the physician view matters as well, because we obviously as physicians perhaps have a better understanding of what something will look like early on and later on, and what a good outcome or perhaps the best outcome could be for a particular situation. So I'm going to go through a study that we recently completed, and I think it offers a unique perspective. What we did in our Mohs surgery unit was enroll over 100 patients who had skin cancer, had surgical reconstruction after their skin cancer was taken out, and then those patients graded their scars 1 week after surgery and then 3 months after surgery. And then what we did was, after the patients graded their scars, we took photos of those patients at those time points. 4 physicians graded the scars, and then we also had objective observers grade their scars. Basically, 10 medical students were asked to grade 100 or so patients, which ultimately translated to over 200 photos. I'm going to show you an example of a scar at 1 week out that, from a physician perspective, would be considered normal, within the range of normal. This is a young girl 1 week after surgery. If you look at what the total of the patients graded their scars at 1 week out, the majority of patients were not very pleased at their scar. They graded it in the poor range. And you can see that physicians 1 week out tended to grade scars reasonably well. It's not yet a happy face, but it's not a sad face. What I think is interesting is that onlookers, folks who had no participation in the care of the patients at all, agreed with the patients. They looked at scars 1 week out and said, this is probably not something that looks great. What we did then is we followed patients out, and 3 months later, assessed the same thing. Patients were asked to grade their scars, we graded their scars, and the observers did, and what we found was something slightly different. It was unanimous that everyone agreed that the scar had improved. Patients felt that their scar looked better, but they were at the point where physicians were at 1 week out, where they said it's not yet a happy face, not yet a sad face. Interestingly enough, the physicians, as you can see with the smiley face, felt that the results for many of these outcomes were very, very good 3 months out, and the observers agreed with the physicians. And I think that tells us a story. What does it tell us? Scars have an impact on conversation. So if you look at JT's eyes here, and they're gazing, they're looking somewhere awkwardly. And so when someone has a facial reconstruction, the person who has the scar on their face is looking at the eyes of the person looking at them. And normally, an eye looks at an eye. But if someone is being looked at and sees someone else's eye looking at the scar, that is distracting to the person who has the scar and can result in anxiety, can result in psychosocial distress, feelings of angst. And so it's clear that there are multiple stakeholders at this that influence the patient outcome. And it's important that we try and tease out how can we get better outcomes, how can we have a better patient experience. We've recently formulated the Penn Dermatology Oncology Center, and these are my three wildly talented, fantastic colleagues, Dr. Miller, Dr. Shin, Dr. Etzkorn. And I'm going to go through 4 goals that we have as we take care of patients with skin cancer. Then when done with that, we're going to transition to how the aesthetic practice complements what we've seen with the oncologic and reconstructive practice. I've shown you a couple of photos of patients who had skin cancer, and it's pretty scary if you've never had one before. What I want to emphasize is that we primarily counsel patients that prevention is by far the most important aspect of care. You want to prevent a skin cancer before you get one. How do you prevent skin cancer? Simple. You wear a sunscreen. And I'm frequently asked, what is the best sunscreen to wear? And it's relatively simple. You want to wear a sunscreen that has an SPF of 30 and blocks out UVA and UVB. It's called broad spectrum ultraviolet protection. You want to make sure that you apply an appropriate amount, and you want to apply it frequently, because sunscreen wears off after 60 to 120 minutes. So if you're outside this summer, every hour or two, just reapply it, because it will work better that way. And that accomplishes goal 1, okay? Now, for those patients who come to see us for skin cancer, top priority is to cure the skin cancer. And being at Penn, in our dermatologic surgery unit, we have cutting-edge abilities to care for patients who have the most challenging skin cancers in some of the most difficult locations. These are photos of our Mohs surgery laboratory. And for those of you not familiar with the Mohs surgery technique, it is basically a very meticulous way to remove a skin cancer to both achieve the highest cure rate and to make sure that we create the smallest possible spot. And we've demonstrated this in research. For patients who have head and neck melanomas, we've published superior cure rates for these tumors. These are some of the more challenging tumors. So if you have a non-melanoma skin cancer, we can tell you that there's a 99 to 99.5% chance that that cancer is not going to come back. And for head and neck melanomas, perhaps even higher. And that's much better than what has been previously done. And so we're proud of that. But once the cancer's out, we have to restore the appearance. And we do that basically with meticulous surgical technique. So that photo of Justin Timberlake earlier where his eyes were gazing across, right? What we want to do is make sure that when someone has had a reconstruction, the eyes don't see the scar. And there have been studies to demonstrate that with meticulous surgical technique, that distraction of the scar can be minimized. Here's an example of a patient who had a skin cancer on his nose, and I've learned over giving these talks the past half decade or so is that you don't show very, very large holes. But this is a gentleman who we had to remove half of the tip of his nose, or in fact, much of the tip of his nose and cartilage. And he required a multiple-step reconstruction where we used his forehead to repair the nose. And the photo on the right is after the surgery. So for someone who has a challenging tumor, we want to be able to achieve these outcomes. And hopefully, the patient will agree that this is a good outcome. Cancers on the midface and patients who have had reconstructions that perhaps have a suboptimal outcome, we can fix and get better. And so essentially what we want to do is reassure patients that if you do have a skin cancer, we can do our best to get you back where it's minimally visible. The last part I'm going to talk about our Penn Doc Center is that we want to recognize the importance of skin cancer because folks know about cancer. When you hear about lung cancer and breast cancer and prostate cancer, it's publicized quite a bit. And when you hear about cancer in the news, it's usually around May when springtime comes and we're talking about melanoma. But there's, out of the 3 million skin cancers, only about 100 or 150,000 of them are melanomas. The others are non-melanoma skin cancers that folks feel like are not that big of a deal, and in fact they are. They have a huge impact on quality of life. And this is something that I'm very proud of. This is a chart that demonstrates that over the course of a half a year, we enrolled over 600 patients in our Mohs surgery unit, and we demonstrated that when you were diagnosed with the skin cancer, your quality of life was reduced. Now, quality of life is a multifactorial construct where the social interactions that you have, the emotions that you have, and your appearance all play a role. And we've learned from our patients that are coming in that different aspects of their quality of life are impacted differently. And what I'm proud to show is that with the treatments that we have, we've demonstrated statistically significant improvements in quality of life when taking out that skin cancer and reconstructing. What this gives us the ability to do is offer precision care for patients with skin cancer. The term precision medicine is very common these days. You'll see TED Talks of folks talking about genomics and phenotypes and genes and DNA, and that's not the research that we deal with. We deal with patients coming in with complex tumors and visible locations, but the data that we have now gives us the ability to know that patients who are younger, our female patients, patients who have skin cancers on their nose, on their lips, and their eyelids, are going to have much higher levels of anxiety before their skin cancer is taken out. And we know that when we perform complex reconstructions, we can now, based on those charts, identify where they're likely to land 1 to 3 months out after surgery, and we're following these patients out 1 year out. So I'm very proud about this, and we're going to be publishing these results soon. But we want to have precision medicine not just in skin cancer, but as I mentioned, I have a second practice, and it relates to patients who have cosmetic concerns. So how can we achieve precise medicine, the best outcomes, and the best experience for patients who are concerned about their appearance? Well, before I get into that, I think it's another exercise that I think is instructive. We've talked about there being 3 million skin cancers in the United States each year. And so these are the number of procedures that are performed in the United States. When you lump the skin cancer and cosmetic procedures, I think you'll recognize that 80% of these procedures that we perform in the United States, the bulk of them are minimally invasive aesthetic procedures and cosmetic surgical procedures, so facelifts, eyelid lifts, injectable procedures, laser procedures. So it's something that is very common. But what is the reason for this? Why are folks undergoing cosmetic procedures? These 3 examples, I think, will demonstrate to you one of the reasons. I want you to look at this photo. Now, this is not someone that I know. It's not a family member. It's not a friend. It's actually a photo from a journal. And it was a study that was published recently where this face was subsequently morphed into a number of different elements. I want you to take a look at the patient here and estimate how old she is. And then on a scale of 1 to 10, 10 being the most attractive, 0 being the least attractive, in your mind, estimate where you think she lies on the attractiveness scale. Well, over 60 onlookers in this study were asked to do that. And the average numbers for this patient basically said that she was about 42 years old, and on a scale of 1 to 10, or on a scale of 10, they grade her about a 5.4. 5.4 is probably a little unfair, but what I think is important here is this face with modern technology can be morphed in a way that illustrates different types of facial aging. This is a morph of a patient who has been aged in the upper face. She has prominent forehead creases and wrinkles, and you can see that the lateral eyebrows are depressed. Look at that photo, and now I'd like you to assess both the age and attractiveness. The folks who participated in the study said that the patient actually looked 7 years older than the photo on the left and dipped by about 1.5 points in attractiveness. Let's do a second photo. Patient here is morphed so that the midface has aged. I'd like you to estimate the age and attractiveness again. In this study, the patient was judged to be at mean of 54 years old, and the attractiveness score continued to decrease. And this is the final morph. This is total facial aging. Same thing, average age, average attractiveness. This patient was judged to be an average of 58 years old and attractive score of 2.2 out of 10. With that, I think that it's fair to say that there's a societal bias toward aging. We all age differently. None of those photos is identical to how everyone else in the world ages. Everyone ages in their own unique way. But I think that onlookers who view folks who have signs of aging perhaps have a bias. And so is that why folks undergo cosmetic procedures? Is it to perhaps look younger? Is it perhaps to gain more attractiveness? This is something that is frequently discussed in contemporary society. This is an example of what was seen in the New York Times. A lot of talking heads talking about Should someone undergo cosmetic procedures? If so, what is the appropriate reason? I'm going to show you 2 studies of whether or not cosmetic procedures can improve signs of aging and whether or not it can improve signs of attractiveness. In one of the studies where cosmetic procedures were done, patients were graded before their surgery, and then photos after their surgery were graded. And for cosmetic surgical procedures like facelifts and eyelid lifts, how much of a reduction in age do you think patients were judged to have? So, for example, if you have a facelift, is it going to take 1 year off, 5 years off, 10 years off, 20 years off?
3.
So the average number of years taken off is exactly that, 3 years. Now, did signs of attractiveness improve with these cosmetic procedures?
Yes.
They did not. And I think that for folks who are aging and are looking in the mirror and are considering undergoing cosmetic procedures, this is important information to have, because I think that there are other underlying motivations that patients have for pursuing cosmetic procedures, and perhaps something that can translate into better outcomes and higher satisfaction. This is a chart where both myself and a colleague enrolled patients coming in for cosmetic procedures and just identified why were they coming in and what aspects of their aging were they seeking to improve. The overwhelming majority of patients, as you can see, were mainly concerned about changes on their eyes, whether it be the middle aspect or the lateral aspect. Many folks wanted improved signs around the mouth as well. What was very interesting, and we were not expecting to find, was that 1/3 of patients said that they were pursuing a cosmetic procedure partly because within the past year or so, they had a major life event. And we didn't necessarily discriminate what that major life event was, whether it was positive or negative, but we allowed patients to describe. And that could have been acquisition of a new job, loss of a job, preparing to get married, divorce. Anything that is a major life event, it seems that there's a psychosocial component to wanting to undergo these procedures. Now, do cosmetic procedures translate into improved psychosocial elements? So for example, if you have an injection to relax the muscles on the forehead, which we said is a major concern, or to relax the wrinkles around the eye, will that give you an improved quality of life after the injection? My colleagues and I studied this and published it in the Journal of the American Medical Association for Dermatology. And of all the procedures that had been done in the past 20 or 30 years, what we found was that there is some evidence to show that you may, in fact, have an improved bump in quality of life, self-esteem, and body image after these procedures. What was challenging about this study is that many of the studies that have been previously done were not done so well. There was a lot of loss to follow-up. Patients were enrolled for different reasons. And so we wanted to study this aspect a little bit better. And so in our clinic over the past few years, we've been enrolling patients for undergoing both injectable filler and injectable neuromodulator procedures to try and identify, can your quality of life, body image, and self-esteem improve? And I'm proud to say that this is something that we'll be submitting for publication soon. 3/4 of patients who had these procedures within 6 weeks felt less bad about their appearance. More than 2/3 of patients reported an improved body image, quality of life, and then almost half of the patients improved with their self-esteem. The last group did not improve to a statistically significant level, but I think it does demonstrate that there are bumps that are measurable. And so how we're measuring it matters, and the fact that we're measuring matters. And this is something that we want to counsel patients ahead of time. If you're coming in with the right motivation, it's more likely, I believe, that you're going to have a better outcome. So what are the procedures that we can do around the eyes? This is a patient who underwent just a single procedure with injectable filler in the tear troughs, and what it will do is soften the shadow under the eye. We can also use lasers to improve signs around the eyes. This is a patient who underwent a resurfacing procedure to smooth out the wrinkles underneath the eyes. Around the mouth is another area of concern for many patients, and this is a patient who underwent injectable fillers to smooth out the smile lines and enhance the lips. Cheeks, we can improve with injectable fillers to improve signs of aging and signs of acne scarring. And we also have laser devices that can improve the quality of the skin. So if wrinkle is not a concern, if there are blemishes or sunspots, here's an example of a patient who underwent intense pulse light treatment to improve some of the sunspots on the cheeks. In the study where we enrolled patients, many patients seem to be concerned with signs of aging around their neck. And fortunately, within the past 2 or 3 years or so, we have the ability to improve that with injectable procedures. We call these lunchtime procedures because you can leave work, come to my office, do an injection, and perhaps take the rest of the day off and the weekend and be good to go. But this is something that is relatively new in practice, and we're pleased to offer patients. I'm going to close by giving one last exercise. And hopefully this will sum up the talk and piece together everything in a nifty way. This is a photo of a dimly lit room, and I want you to imagine that in this room is a cylinder hanging from the ceiling. And in order for you to see as you're walking in the room, I want you to imagine that you've got a flashlight in your hand. If you shine a flashlight on this cylinder, what are you going to see on the wall as its reflection? If you walk in on the left side and shine the circular part of the cylinder, you're likely to see a circle on that wall. If you walk in from the right side of the room, you're likely to see a rectangle on the wall. Now, which side is right? It's your perspective. The perspective that you have is going to give you the ability to see what you're seeing and then also judge what has happened. So this is an example of a patient who came to see me. The photo up top is before, and the photo afterwards, the photo below is afterwards. This is a patient who has a scar on the forehead and who is more concerned with both the horizontal lines on the forehead and the vertical lines near the eyebrow. And we achieved for him a success. Now, you may look at these photos and perhaps think something different, but it's the patient that matters, as everyone said in the beginning. But what we see matters as well. So when you're going out there in society, I want you to sort of think through these, and you'll come up with other examples, I'm sure. I want to thank everyone for being here. You all have nice bags of swag. There's more outside as you're walking out. So I do want to thank, again, everyone who's pieced together this session. It's a lot of effort to bring everyone together. I want to thank folks who have funded my research. The Dermatology Foundation and the Center for Human Appearance have been generous, and all of my colleagues and mentees and mentors who have participated in it. It's a real honor to be here at Penn, and so hopefully we're going to continue to build on what we've done, and in a few more years put together something with even more exciting news.